What is syncope? Syncope is the sudden loss of consciousness due to temporary failure of cerebral circulation. So the reasons are loss of blood or hemorrhage, inadequate venous return to the heart. So this can be because of heat and immobility. There is pooling of blood in the lower part of the body, which leads to inadequate venous return of blood to the heart, which leads to syncope. Another reason for why syncope occurs is because of the fault in the circulatory system. So if there is any heart block and paroxysmal tachycardia, there is the fault in the circulatory system, which leads to syncope. Another one is carotid sinus syncope. When there is pressure in carotid sinus, there is slowing of the heart rate, which leads to fall in the blood pressure, leading to syncope. The next one, reflex syncope. This is because of pleural puncture or cistern puncture. This can be during the surgical procedures also. Now, emotional stress can also lead to syncope because what happens is there is this reverse in the arteriolar vasoconstriction. So there is sudden vasodilatation when the person is standing. So there is immediate fall in blood pressure while the person is already standing, which leads to bradycardia and thus syncope. So other reasons can be certain drugs which blocks the autonomic transmission, hence causing the fault in the circulatory system leading to syncope.